but you will be able to unmute yourself. Closed caption will be available on this event, so just click on the CC at the bottom of your Zoom screen. We are going to be recording the session like all the Mental Health TTC's events, and you can find it in our website within 24 hours. If you're interested in a certificate of attendance, please follow up with an email, and any kind of questions. We're going to be actively looking at the chat. We love that you are engaged, and they're going to be here joining us for an hour. Next, the New England Mental Health TTC Technology Transfer Center is partnering with the third sector for this event. As we are a funded center from SAMHSA, the Substance Abuse Mental Health Services Administration, and all the opinions expressed are the view of the speakers. They do not reflect any of SAMHSA's positions. And lastly, as an introduction, next slide, just want to remind you, our network uses affirming, respectful, recovery-oriented language that is inclusive of all diverse culture, genders, perspective, and experiences. So please join us to have an amazing conversation today without using any labels and avoiding any judgments. So I am going to turn it over to my colleague Janan from the Yale Program on Recovery and Community Health as well to introduce, welcome back our amazing team from third sector. Thank you, Janan.
Thank you. Welcome, everyone. Apologies, I had to get the door, so I'm moving throughout my house on camera. Working from home, as we all know, can be fun. So I just want to welcome everyone back. For those who attended the webinar 2 weeks ago with our partners, welcome back. I'm really excited that we get to do a deeper dive in today's conversation related to equity and the use of data. So I will turn it over in the interest of time so that we can really get started. I know we have some breakout groups, and so I'm really looking forward to an interactive session this afternoon. Thank you.
All right, welcome everybody. Welcome back to those of you who joined us for the webinar. I'm Maria Posey, I'm Managing Director at Third Sector Capital Partners. Before we get started, just could we get a quick show of folks using the reactions icon to give a thumbs up if you were here for the webinar before, just so that we can get a sense of if folks have heard from us already or if they are coming fresh to this conversation. So doing a read if you use the reactions button, or if you come on video and just give me a physical thumbs up, thumbs down. Okay, so some mixed so far. You don't know where the reactions button is. Okay. All right. So sort of a mix across the board. So then it's a good thing that we'll be starting with some introductions of who we are, both as individuals talking to you today, as well as an organization. We will kind of remind folks or introduce for the first time the framework that we use for incorporating equity and data collection, data analysis. If you have not had a chance to see the webinar, it is up on the MHTTC website. You're more than welcome to kind of look back at your own time and get insight into some of the examples that we shared from our work in line with incorporating equity and data. And so today's conversation, we will just do some quick introductions of us and who we are. We'll spend the bulk of the time in an interactive session really digging into some of the challenges that you all may be experiencing with respect to using data for equity, and hopefully finding some innovative solutions through some peer learning and peer discussion, and then wrap up at the end with just some next steps and announcements. So let's move on. So if you joined the webinar before, you already heard from myself and from my colleague Emma Goodman, who's a manager working on many of our mental behavioral health programs. Today, we are also joined by two additional directors, Zach and Nicole, who are also based out in California and have spent years working with the counties in a county administered structure to improve and revise some of the California funded initiatives supporting people with serious mental illness. And so they are here to share their additional experiences from really digging into the weeds of some of these programs, and also to help facilitate some of the conversations. Right. So today's goals include reviewing the 5-step process, as I mentioned. We'll have a chance to crowdsource some of the challenges that you all are experiencing with respect to data and equity, and then spend time in breakout rooms really digging into some of these challenges with some hopefully innovative solutions on the table as well, with the goal that by the end of the session, you will have some concrete, immediate, low-hanging fruit action items that each of you individually can take back to your contexts and hopefully make some progress on to make this very sort of action oriented. All right, let's give you a reminder, refresher, reintroduction, or new introduction to who we are. So Third Sector Capital Partners is a national nonprofit organization that advises our government agencies toward better outcomes for all people, no matter these people's race, background, or circumstances. As you can see in the map, we've worked in most states in the country at this time in our mental behavioral health work, as well as in our other practice areas, which include diversion and reentry work, workforce development, economic mobility, and early care and education, with a lot of our projects actually touching one or more of these areas, as the families that our programs serve a lot of times have intersecting barriers and needs. We focus on the funding and the data connected to those funded programs, and have supported our government agencies in reorienting upwards of $1.2 billion towards equity and improved equity and outcomes. And we do this work through a framework that we call an outcomes-focused government approach. And through our work with our government partners, we have really identified 6 building blocks that together make up the system for social and for mental and behavioral health programming, as well as other human service programs. These building blocks include the use of data, which we're going to be digging into today, and how quantitative data about program outputs and outcomes, as well as qualitative data with insights from stakeholder engagement, interviews, conversations, inform the progress and status and needs of any particular program. And then using that data to drive decision-making in how services are designed and delivered, and also how those programs are funded. A lot of times looking at funding as a mechanism for improving the incentives for clinical partners and training providers, and how funding can implicitly or explicitly incentivize certain behaviors within those programs, and wanting to ensure that the money is aligned to the values and the purposes of the programs. We then also support on a number of sort of less tangible fronts, including building and supporting partnerships between program administrators at the government level, as well as community partners, providers, evaluators, academic partners, clinical partners, etc. Understanding that it takes a village a lot of times to really truly support and meet people where they are, and help address the various barriers that people may be experiencing to a healthy life of well-being, economic mobility, and overall thriving. Internal culture kind of works through the various other building blocks, understanding that at the end, we are all humans with our own experiences, perspectives, positionalities, where we're from, how we were raised, and that these often influence how we show up in our work, and that that could influence in turn the kinds of culture that we set up in our agencies, in our workplaces, and in interactions with the program providers and the participants. And so sometimes our work really involves digging into some of those pieces as well, looking at cultural competencies, biases, etc., that may impact how some of these other building blocks manifest in the work. And then also around policy, a lot of times real or perceived limitations on eligibility, length and type of services, funding restrictions, etc., get in the way of really being able to be data informed and equity centered. And so we sometimes look at, well, what do those policies need to do to really shift the narrative and allow for the kind of work that we know needs to happen. And so next slide. Third sector then works along these 6 building blocks as an intermediary between government and the service providers. So we are not clinical experts, but we often partner with those who are. So for example, in our work in Southern California, we've partnered with UCLA to really help advise on the specific aspects of the community assertive treatment model that is used in the program for seriously mentally ill individuals. And we also often partner with evaluators who can help apply sort of an evidence scientific approach to assessing the impact of revised programs. And so you'll find us in the middle of these various groups, facilitating, coordinating, aligning, really driving the process of improvement and system change forward, recognizing that most of our partners have very busy day-to-day demands, and the initiatives around process improvement to become more outcomes and equity focused often takes some intentionality and some commitment to really drive forward. And so we support those efforts to foster that system change. All right, that's it from me. That as the non-mental behavioral health person of this third sector crew is all you'll really hear from me until the breakout spaces. I'll turn it over to Emma, who is going to kind of talk us through the exercises of the day.
Great, thank you, Maria. So as Maria mentioned, we will be spending most of our time today working really collaboratively together to dig into challenges that you've either seen or experienced in your own work around using data to guide decision-making and realize your equity goals. And we'll do that by first working together to build a better understanding of the challenge. So why is this challenge occurring? Who is most impacted by this challenge? And then we'll spend time together problem solving and developing some solutions together in breakouts. But before we do that, I'm just going to start by giving a brief overview of the 5-step data for equity process that we introduced during the May webinar. And for those of you who attended that webinar, hopefully this will be just a little bit of a refresher for you. And for those who are coming to this material for the first time, hopefully this will set some good context before we dive into discussion. Okay, so as I mentioned, during the webinar, we introduced a 5-step process for using data to uncover insights, design solutions, and take actions to ultimately improve outcomes and advance equity. And this process is depicted on the right side of the slide. And as you can see from these yellow arrows here, this is a really iterative and ongoing process. So this is not evaluation at the end of implementation. We like to call this evaluation in motion. And this is really used to assess outcomes in real time and make updates to systems and services that feel more flexible and proactive. So this is really engaging in that continuous improvement and learning. I'll just quickly walk through each of the 5 steps in this process. So the first step is to build consensus with your partners around a set of shared and clearly articulated outcome goals. And during the webinar, we shared how there might be many different outcome goals. Some of you might be working to increase housing stability. Others may be really focused on eliminating racial disparities in retention rates or in engagement rates. So an outcome goal can be many different things, but it's really important to first align around what you're working towards with your partners and other stakeholders in your community. The second step is then tracking progress on those outcome goals by collecting data, qualitative and quantitative data, on metrics such as the number of days in stable housing, the number of times someone might have been housed unstably in the previous 12 months. So metrics often have that number percentage stamped to them, and they just put a little bit of a finer point on outcome goals. And we always suggest, alongside collecting data on those metrics, collecting demographics as well. So race, age, gender, various other demographics that feel important for your community, so that in step 3, when you're capturing insights for deeper discussion through breaking down the data and analyzing the data, you're actually able to notice any disparities in outcomes among groups of people being served. So that's step 3. In step 4, once you've captured those insights, you will be analyzing those results and insights with your partners. And that involves both sharing data that's been disaggregated by demographics such as race, ethnicity, age, gender, and then also unpacking the whys behind any trends that you're seeing in the data. So really working together to develop a better understanding of what's actually behind and underlying the data. The final step in the process is a culmination of all of the other steps. So it's really using what has been learned through the data to develop revisions to systems and services with your partners in order to address any disparities that you're seeing and improve outcomes. So these are the 5 steps in the process. And then on the left side of the slide, we have 4 values and mindsets that we've seen provide the foundation for successful implementation of this process. So the first is that you want to embody a learning mindset, and that really means that failure is not a bad thing, but rather it's an opportunity to uncover new insights that will ultimately lead to better outcomes. The second is racial equity. We know that looking at disparities and outcomes that result from delivery of programs is really necessary to making sure that everybody is getting the support that they need to make movements on their recovery and stability journeys, regardless of race or ethnicity. The third is trust and shared accountability. So working to build trust with your partners when you're looking at data, especially if you're seeing things that you want to be working on together, and creating space where everyone involved in those conversations is accountable to uncovering insights and addressing challenges together. And we'll be practicing some of that shared accountability and discussion during the breakout today. The last value on here is staying human-centered. So keeping the end users, whether they are clinicians, case managers, people involved in behavioral health services, keeping those end users at the center of any revisions you're making to systems and services, really to increase the likelihood that changes are relevant and valuable. So I know that was just a quick overview, and we'll have ample time in breakouts to dig into any questions that might have come up for you just now. So drop those questions into the chat, hold on to them. We will have time to discuss together. And for those of you who are on the webinar in May, if you had any lingering questions, we're happy to answer those as well. But I want to make sure we have time for our activity today. So I'm going to transition us into the interactive portion of today's diversity talk. So before we move into breakouts together, and thank you to the New England MHTTC for managing the breakouts and all of the different logistics for this meeting, we want to start by mapping the challenges that you have either experienced or seen with implementing this 5-step process or pieces of this process in your work. And we'll do this using a tool called Padlet. And for those of you who haven't used Padlet, it's a platform that you can use to add responses to various prompts. And I'm going to drop the link to the Padlet into the Zoom chat. And as you're opening the link, you will see that the prompts in Padlet correspond to the steps in the process that I just introduced. So we're going to spend about 5 minutes now taking time to write up some of the challenges that you've seen or experiences by clicking the plus sign under the prompts. And feel free to add as many posts as you like to each prompt, and be sure to include your name in those posts as well. And I think the question that Tavis put in the chat, what about possible cherry-picked data? I think that's a great challenge or question to add to the Padlet. So feel free to, as you're thinking about this and doing some remembering of things you've experienced and seen, do just that and sort of draw from your own experiences. So we'll give folks 5 minutes to write up challenges. And as you're interacting with the Padlet, feel free to drop any questions or challenges that you're having with the platform into the chat. We will be monitoring it and can help out with the tool. And I will do just a quick share screen of how to put a post to Padlet. All right. Okay. Can you all see my screen? Okay, great. I see folks are already adding, which is awesome. So if you want to add a post, you just click the plus sign here. You can write a subject, which I see folks are doing over here. And if you want to add more detail to the challenge, feel free to write that down in this lower section. And once you're done, you then can click publish, and that will add to the prompt. So feel free to keep adding. I see folks are putting those in, which is great. And as I said, we'll have about 5 minutes to do that, and then we'll come back together in breakouts. All right. Looks like we're getting lots of great responses and folks are still adding them in. So feel free to give me a thumbs up either on video or in Zoom if you would like another couple minutes to add challenges. All right, let's give it one more minute, Lee. All right, so it looks like we're at time. I'm gonna give folks just a minute to scroll through some of the Padlet responses and see what's coming up for folks. And what we're gonna do at the end of this minute is select 2 different themes that are coming out from these challenges that we'll then dig into 2 different breakout rooms together. So we'll give folks in a minute an opportunity to pick the breakout that resonates with them most. But why don't you all take just a minute to look through the different challenges here in the Padlet and to upvote things that are resonating with you or downvote things that aren't. I see that some folks have already started to add little plus signs or thumbs up signs to people's comments and challenges. So take a minute and do some upvoting, and then we'll come back together to move into breakouts. I see, could we get a copy of the Padlet? Yes, of course, we are happy to provide a copy after this session. And if anyone's unable to access the Padlet, do let us know in the chat. All right, thanks for doing some of that upvoting. I see that some challenges are getting lots of upvotes, which clearly means that they're shared among lots of different folks here. So thanks for adding that. And we'll now spend some time digging into these challenges and breakouts. So we'll have two different breakouts. We'll have one focused on challenges related to collection of equity-centered data, and that will be with me and Nicole. And then we'll have a second breakout related to challenges related to revising systems and services in response to data analysis with Maria and Zach. And we'll have time in each of those breakouts to first develop a shared understanding or a clearer understanding of some of the challenges listed here in the Padlet. So how frequently are they occurring? Who is most impacted? And then we'll have some time to problem solve together. So we'll spend about, I think, 15 minutes in breakouts, and then we'll come back together for a brief share out across the two breakout rooms before discussing next steps. All right, so Lee, I think you can go and open the breakout rooms, and feel free to join whichever breakout room is most interesting to you. Being mindful, of course, of if one room seems to have lots of folks, perhaps joining the second room. All right. Are folks able to assign themselves?
Yes, so you'll want to look under breakouts and click join on the one that you would like to join. I see folks starting to, but breakout group number 1 is on collection, as Emma stated, and breakout group number 2 is on revising systems and services. So you will need to choose. If you need any assistance, please let me know in the chat.
All right, great. Thank you all. See you on the other side of the breakouts.
For those of you who have not chosen a breakdown room, could you let us know if you're having difficulty or tech barriers? Perhaps we can be of assistance. I see Tavis Carter, Deborah Gary, Jacqueline Joyner, Julia Ernest. I apologize if I'm mispronouncing anyone's name, but
I don't see anything offering a choice to assign myself, so.
Yes, same here.
Yeah, folks, if you add your choices or just verbally say them, I will be happy to assign you into that room so you can go ahead in.
Doesn't matter which one you assign me to at this point.
Okay, no worries. Still lots of time. I'm gonna.
Okay, I'm
group
getting a
number
choice
1.
now.
Awesome. And Laurel,
Yeah,
can I put you in collection?
Fabulous. Thank you.
No problem. And then I see Julia, and then I know we have a phone number, 617-599, and I'm happy to direct you to whatever room you'd like me to. Deborah and Jacqueline, I also see you here on the list, so please let me know either verbally or in the chat where you'd like me to place you. No problem, Julia. Thank you for letting us know.
thank you, Lee, for all of your tech support. Deborah, Jacqueline, or the phone number ending in 2125. You could let us know via the chat or unmute yourself to let us know which breakout room you would like to join. or if you can hear us at all, that might be a good starting point as well.
All right, we are good to close up the meeting in, I would say probably 5 minutes, Emma said, but that was also a minute ago. So maybe 4 minutes. Does that sound okay?
That sounds good.
Awesome.
Thank you for checking.
Of course. No problem.
Lee, can you come to every event? I love your energy.
Oh, thank you. That is so kind of you. I just want to make them less drudgery, right?
Yes.
Like everybody has to go to webinars, but make it fun.
Absolutely.
And also just, I worked with children. I ran an after school program before coming to C4. So I just use my voice to calm people, ideally.
That's nice. Yeah, patience is a virtue I'm still working on.
Yes, I'm certainly not patient in my non-work life, but I try to bring it as much as I can to my work life.
It's like you like your job too, you know, like you're ebullient.
I do love it. Yeah, it's very cool to get to, sit in on meetings like this one and really, feel like what I'm doing is connecting people to resources and, assisting them because there's enough going on in the world.
Exactly.
Okay, I am going to send a message letting folks know if we can close in like a minute. Does that sound okay to you guys? I know that at 1:48, Emma said 5 minutes was good.
That sounds good to me.
Yeah.
Okay, I always like giving people notice because then it takes a little while for them to come back. Oh, sorry, pup. All right, folks are going to be coming back. They have a 60-second countdown, so they should be joining us again soon.
All right. Well, I know we were all thrown back into the room. I know my group was deep into discussion, and I'm sure the other breakout group was as well. Looks like I know on our end, we had more time to dig into challenges, and I think in the other breakouts similarly. But that's okay, because developing a clearer understanding of the challenge is really always the first step to being able to come up with some good solutions. So we have about 5 minutes left, and I want to make sure we have a little time to discuss next steps. But before we do, does someone from breakout group number 1, which was my group and Nicole's group, want to come off mute and just share one thing they're taking away or they're still noodling on, wanting to develop some solutions for? And you can see some of our notes down here. Virginia, Tavis, Dee, Kim, Laurel, anyone want to come off mute and just share one thing that you're still thinking about from the breakout today?
For what it's worth, I would say systems, data collection systems that were in place and are still being used haven't been updated. And we're asking that system to gather, compile, and spit back out a report that it wasn't designed to do. So we find ourselves trying to tweak an old system to give us new data. And you can forget it asking for a new updated system. You know, you'll be filing your retirement paperwork, and they'll be saying, we're looking at like 3 different contracts right now, and we're going to pick between the 3 of them.
Yeah,
I think that's a valid factor, but we do the best we can with what's available to us.
yeah, no, I hear that, Tavis. Really the limitations of the system itself in terms of impacting what you can collect and analyze. Does one person from Breakout 2 want to just take a second to share any final thoughts before we move to next steps?
Since we abruptly cut Ayana off mid-sentence, I'm gonna invite you to
Any
be brave.
devices. So how is she talking to him?
Ayana, would
Okay.
you be open to completing
Sure.
your thought? That
Well,
was so
yeah, I
abruptly
was just
cut off?
saying that, sure, absolutely. I was just saying that what I try to do is just get creative and form different collaborations outside of our traditional roles. So I work with a lot of different agencies, and we try to come up with ways that, even though my company may not have the funding or can't meet the client's needs in a particular way, then I try to work with other agencies that, so that we can form partnerships.
Thanks so much, Ayana. And I think with that, we are wrapping up this session. Do please, if you are open to a chat, one-on-one follow-up with third sector and how we might be able to support your data for equity journey, do please drop your email into the chat, and we will schedule some time to consult further. We are always looking to expand partnerships and support the work. And I believe we'll pass it over to Maria and Ingrid and Dr. Wyatt to close us out.
Thank you. Thank you so much. We are very grateful that you were able to join us today. I hope there were some nuggets that you could take along with you. Again, we just want to continue to build community and a shared space with each other. So we hope that you continue to attend our REACH seminars moving forward. We have one upcoming, hopefully in July, that we're still putting the pieces together, but we hope to see you there. Just as a reminder, our funding comes from SAMHSA, which requires us to evaluate our services. So you will be getting a link via email that asks you to give your feedback on today's session. Please answer as openly and honestly as possible. Your feedback definitely counts. And if you are looking for more information regarding our work, please reach out to us at the New England MHTTC, and we will be happy to connect with you. Thank you, everyone. Have a safe and wonderful afternoon, and we will see you next time. Bye.
Well, for joining us today.